Hello, and welcome to Gun Violence in Missouri, Seeking Solutions, presented in partnership with the Kansas City Star and American Public Square at Jewell. My name is Allison Kelzer, and I'm the Student Initiative Coordinator at American Public Square. In the past few months, Kansas City Star reporters have interviewed citizens, activists, faith leaders, and survivors of gun violence as a part of their Missouri Gun Violence Project. This project was undertaken in partnership with the nonprofits Report for America and the Missouri Foundation for Health. Just this past weekend, 3 people were injured and one man, Gary Taylor, lost his life in a shooting near the 18th and Vine district in Kansas City. The same weekend, KCUR reporter Aviva Okeson-Haberman lost her life after being struck by a bullet that flew through the window of her apartment in East Kansas City. These tragedies, on the heels of the city's worst year of gun violence on record, are a sobering reminder for the need for reporting, investigating, and community conversations like these to seek solutions around gun violence in Missouri. Today, we've assembled a group of panelists who are dedicated to addressing gun violence in effort to improving their communities. Understanding that reframing violence as a public health issue is vital to the health of our communities and for a framework for impactful change. The goal of today's event is to engage in our community members and work together to understand long-term solutions to reducing violent crime. We will have a civil, fact-based discussion exploring how we can move Missouri forward. As a part of American Public Square and Kansas City Star programming, we welcome questions and fact checks from the audience. Please comment on the live stream with your questions or requested fact checks. Ian Cummings, editor with the Kansas City Star, will serve as today's fact checker. You can also find a fact sheet to support today's conversation on our website at www.americanpublicsquare.org. With that, I'll turn it over to our moderator, Kaitlin Washburn, reporter for the Kansas City Star.
Thank you, Allison. Through the Missouri Gun Violence Project, the Star is examining gun violence from a novel approach by exploring its many forms, understanding root causes, and identifying effective solutions. Our latest series is exploring how gun violence is impacted by and impacts a community's social determinants of health. Those qualities of life conditions include having stable and secure housing, accessing good food, attending quality schools, and growing up in racially segregated or economically depressed neighborhoods, what researchers call the social determinants of health. Today, we are examining income and how this affects gun violence in communities. Experts say Missouri's leaders should address gun violence as a public health problem and implement policies that impact underlying conditions that put people at a greater or lesser risk. Public health experts, gun violence researchers, and residents of communities hit hardest by gun violence say income, or the lack of it, is one of the key factors that determine how likely a person is to be a victim or a participant in gun violence. The connection between violence and poverty is strong. Experts say poverty works on multiple levels to make someone more likely to experience gun violence. For example, high poverty neighborhoods might not have quality education opportunities to set kids up to succeed, and physical features like abandoned buildings and vacant lots can be more conducive to violence. And that reality is true for both the urban and rural portions of Missouri, whether the gun violence is a homicide or a suicide. Now, to begin our discussion today, I'd like to introduce our panelists. Please welcome Linnell Phillips. She is the Vice President of the Missouri Public Health Association, a registered nurse, and assisted teaching professor at the University of Missouri. Then we have Marcia Keene Fry. She is the CEO of the Susanna Wesley Family Learning Center in Mississippi County, Missouri. We also have Ari Davis. He is the Senior Policy Analyst at the Educational Fund to Stop Gun Violence in Washington, D.C. And finally, Jessica Myers. She is the Project Director at the St. Louis Area Violence Prevention Commission. Thank you, panelists, for joining us today. I want to start by stating that we are examining the gun violence issues that plague Missouri, and we know that this is not just an urban or rural issue, but a statewide issue. So let's get started by first focusing on economic factors that affect our state's communities. Jessica, we're going to start with you. Can you describe how poverty and gun violence plays out in St. Louis communities?
Absolutely, and thank you for having us. And we just want to express our sincere condolences to all of the Kansas City media members on the recent loss of one of the reporters. When we're talking about economic conditions in St. Louis, we can't divorce that from racial issues and a history of systemic disinvestment. So in St. Louis, the Del Mar Divide is along Del Mar Boulevard, and this is kind of known as the socioeconomic division of the city of St. Louis. It divides the city along racial lines and along economic lines. And also it divides much of the region along lines of concentrated poverty and concentrated violence. And so in the cities, or in the neighborhoods north of the Del Mar Divide, you see systematic disinvestment. You see high concentrations of poverty, high concentrations of vacant lots, high concentrations of lack of healthcare, lack of healthy foods. And so this is all contributing to the crime and violence that happens in those neighborhoods. And simultaneously in these neighborhoods, you have the feeling that they're simultaneously over-policed and under-policed. So they feel, residents of these neighborhoods feel that they're often targeted for enforcement mechanisms of the police, but when they call the police to respond to violence, they don't necessarily get the response that they would like. And so you have lower cooperation with law enforcement in many of the areas that have concentrated disadvantage. This leads to a cycle of violence in which perpetrators aren't arrested and are free to commit more violence, and you may have retaliatory violence. So all of these social determinants of health, the systematic disadvantage, the systematic racism, all contribute to the experience in these neighborhoods of high rates of violence and lack of access to social determinants of health.
Thank you. Marcia, your experience has been in the Boot Heel region of Missouri. Can you talk to us about the gun violence that impacts your community and how economic factors factor into those experiences?
Sure. So I've been with Susanna Wesley Family Learning Center for 26 years, and we work in rural Boot Heel counties in Missouri. Currently, Mississippi County ranks 112 out of 115 counties in Missouri for risk factors for children, with over 40% of children under the age of 6 living in poverty. So poverty is a huge issue throughout the county. The gun violence issues plaguing our area are related to primarily, in my opinion, drugs, poverty, gangs, and then we have the separate issue of domestic violence, homicides, suicides, and suicides. When people are desperate and they don't see a lot of chance for upward mobility or change, then they do desperate things. And I feel like the economic conditions in our community very heavily influence gun violence and the opportunities that people think they have. A lot of people don't really see or don't believe they have a different outcome or opportunity.
Next, we're going to have a question from the audience. Craig S. asks, poverty reduction and economic mobility are often viewed as gnarly generational challenges. What are some first steps that passionate and concerned residents can do to improve economic mobility? Linnell, would you like to take that one?
I think that, well, first off, let me say that I also extend my condolences to the media community there with their loss. That young woman was a University of Missouri graduate, and so very tragic, and we're all very disturbed by that tragic loss. So I would like to talk about poverty as a culture and a misunderstood culture. So it seems as though we still shame our poor in this state and in our country. And I think that comes from a lack of understanding of what it is like to be poor, and movements towards building bridges so that people that are not living in poverty have some understanding of what it's like to live in poverty and the different types of poverty in terms of generational poverty, situational poverty, working class poverty, is critically important moving forward. I think we've made a lot of progress in terms of understanding each other in terms of race, but I think understanding each other in terms of the culture of poverty is our next challenge as a society if we're to turn around policy issues that affect the poor.
Thank you. Now we're going to move on to talk about public health strategy and community supports. Poverty and poor health are proven to go hand in hand. The life expectancy gap can span as much as 10 years between the wealthiest Americans and the poorest. We've touched on how gun violence is a public health problem. Ari, can you explain what a public health approach to gun violence prevention looks like?
Sure. Thank you. Thanks for having me. I'm really excited to be here. And so I think when we look at, and you guys did a great job outlining kind of the public health epidemic of gun violence in Missouri and in this country. But I think if we look at it, I mean, it is like any disease. I mean, I just pulled this data from the CDC, but it's the leading firearms are the leading cause of death for folks under 34 in Missouri, right? So, more people are dying by firearms. Young people are dying by firearms than by other diseases that we treat through a public health approach. And so that term is kind of thrown around a fair amount, but what it really means is first taking a very comprehensive approach, looking at the social determinants and the root causes of violence, and then also looking at kind of the more immediate interventions that can be tailored to address the risk and protective factors to stop gun violence. So I think in Missouri, like you said, I mean, the root causes. There's a lot of overlap between what we see for firearm suicide, which makes up more than half of gun deaths in the state and is often rural, and gun homicides, which often occurs in cities and disinvested neighborhoods. And so addressing those social determinants like poverty is key. I think when we start to look at like the specific interventions, we need to have specific interventions tailored to the different types of violence, whether it is firearm domestic violence, or community gun violence, or firearm suicide. So, I mean, I think that, and hopefully we can get into this a little bit, but when it comes down to it, it is, access to firearms plays a role. So we also, if you're looking at the public health approach, yes, addressing all of the root causes, but also looking at policies to address kind of the supply side and provide supports for individuals who are at heightened risk for violence victimization or perpetration.
Thank you. Linnell, what evidence-based programs and initiatives have you seen that change the narrative about poverty and what it takes to boost economic mobility? And if it's something you've seen here in Missouri, that's a great example. Or if there's others that you can speak to, that would be great.
I want to first. I'm going to take my earbuds out. I think they're causing troubles. I wanted to first talk about disparity versus poverty. So it's one thing to be in a community where there's poverty and everybody's living in poverty and you all sort of pull together and get through your life that way. But with disparity, it's the difference between the rich and poor. It's the gap. And some communities in poverty, like someone earlier mentioned, the Del Mar Divide, literally people living in poverty are right across the street from people living in prosperity. And what a dispiriting situation to live in. And so disparity takes its toll on the psyche of people more so than just poverty. And it's something that we need to recognize in this country, is that our economic disparity has widened and widened over the last several decades to the point where our country is similar to like Eastern European countries. And so turning that disparity around and shrinking that income gap is going to be really critical moving forward, not just in our state, but in the country. But to your point, in terms of what it takes to change the narrative about poverty. So again, it goes back to understanding. And one thing that we've done here in our community in Central Missouri is we work with Central Missouri Community Action, and they put on a poverty simulation for various civic groups and university groups. And that's been, in my opinion, really, really effective in changing the narrative about poverty and promoting understanding. Folks living in poverty that are clients of CMCA participate and share their stories. And I think more of that interaction really needs to happen, more opportunities for people on either side of the income gap to come together and really understand each other's lives.
I'm sorry. I have heard of the idea of reinvestment and rebuilding communities in both rural and urban areas. What's needed to build up both of those communities, and how does that happen without gentrifying urban areas? Jessica, would you like to take that one first?
Absolutely. So one of the things that we know is that there is factors of neighborhoods that are both risk and protective factors. I think you talked about that a little bit earlier. And one of those that we've particularly identified through our research and some of our committee work is vacancy. So what we found is if you're within 150 meters of a vacant lot, especially north of that Del Mar Divide, that your risk of being a victim of aggravated assault goes up about 11 times. And when we've canvassed and done community engagement and asked neighborhood residents, what's your biggest concern, your biggest safety concern, a lot of times they mention vacancy and things like that before they mention traditional street crime. So first point is that community engagement like that is vital to help identify what neighborhood residents are really concerned about poverty, about economic mobility, and about violence. And to know that there are studies, for instance, there was one out of Philadelphia that showed just cleaning and mowing those vacant lots had a significant reduction in gun violence around those vacant lots. So it doesn't take much to turn a neighborhood risk factor into a neighborhood asset, a park-like structure in the neighborhood that neighbors can actually use. How we do that without contributing to gentrification and especially displacement. A lot of times when people talk about gentrification, one of the things they're really worried about is displacement. Taking folks who have lived in neighborhoods for generations and pricing them out or otherwise forcing them to move out of the area. And part of that, again, goes back to community engagement. Forming community benefit agreements between neighborhoods and developers, where neighbors can identify what factors they want to see to improve their neighborhood from development. It might be including low-income housing. It might be including grocery stores where they can get access to fresh fruit and vegetables. It might be having a clinic in the development. All of those are important to allow the community to really define how the investment occurs. And then from there, we need to look at inclusionary zoning. Any new development needs to have a requirement that it has not only middle income housing, but low income housing as well. So we're not just placing folks from neighborhoods that they've lived in. And then looking at things like nuisance ordinances. Nuisance ordinances in Missouri often lead to low-income domestic violence survivors being displaced from their housing for repeatedly having to call 911 or to call the police to respond to the cases of domestic violence. So we need to reevaluate using a racial equity lens how we do that. One of the groups in St. Louis that is doing that really well is Invest STL. They're people-centered, place-based community development that really focuses on developing communities with community input. So focusing on that community and centering community voice in development decisions are vital to making sure that we are addressing violence, addressing economic mobility, economic inequality, but also addressing the concerns of residents to reduce violence in their neighborhood.
Thank you. Same question over to you, Marcia. When in your community, what needs to happen to reinvest and rebuild?
In the 1990s, all the manufacturing plants left Mississippi County. So during that time, prior to the 1990s, families in Mississippi County could earn a living wage, have health care provided for their families at low cost, and they could take care of themselves and their families. When all of those manufacturing plants left, there wasn't a plan in place to replace those jobs. And so since that time, there's been a huge struggle for people to earn a living wage. So one of the first things that needs to happen is we need some economic investment. Sometimes people will say to me, you don't have a workforce in Mississippi County. And that's why manufacturing won't come there or other industries. And I disagree with that because I worked at that factory, one of those factories, as a teenager and young adult, and there was a workforce. It's just that people cannot afford to work and pay childcare and other expenses related to work. I mean, most people have to travel that live in Mississippi County 20 to 30 miles to have a decent job. Transportation is an issue. There's no public transportation. Our social safety net programs are lacking. I mean, there's us and a couple of other organizations that work together, but really we need to invest in people and make sure that we are doing so in such a way that people can have job opportunities and they can safely go to work. They have childcare. They have safe transportation. And until we start doing that, I don't see the situation improving a lot here because the median household income for families living in Mississippi County with children is a little over $28,000. So you can imagine if you're trying to pay rent or a mortgage and childcare and get into work, and I mean, you're not going to be able to afford health care, probably have it available to you. Those are just huge risk factors, and they're going to continue to be there until we do something about the lack of job opportunity in this area.
Thank you. Now we're going to talk about policy and its impact on economic mobility and gun violence in general. So to make a difference on a larger scale, experts say change must be made at a systems level through policies, and revitalizing communities requires major funding. Yet Missouri ranks 6th to last in the nation for public health funding. We've discussed how the economic and social conditions can fuel violence. Ari, can you talk about the role guns, and specifically gun policy, plays in contributing to gun violence and how it relates to these root causes we've been talking about?
Yeah. Missouri also ranks has the 6th highest gun homicide rate in the nation. So clearly these things are linked. And I think when we want to look at potential policies to address gun violence, we can look at the supply side. So Missouri used to have a licensing law. So to purchase a handgun, you had to acquire a license, just like if you wanted to drive a car, you have to acquire a license. And they repealed that in 2007. And there's some pretty strong research showing that there was a link between repealing that law and a spike in violence over the next 3 to 5 years. So there was that repeal of that law was directly associated with a 25% increase in gun homicides, and a 16% increase in suicides. So we know that when you repeal the laws that are there to ensure that individuals who are at elevated risk can't access a firearm, you can see the direct result of that. So I think passing strong laws is very important. I think when it comes to at the city level and addressing community violence, it's really investing in programs that interrupt cycles of violence, right? So I believe one of the panelists talked about kind of the retaliatory violence and the lack of trust in current institutions and law enforcement. And so to really interrupt those cycles, we need investments in community-based violence intervention and prevention programs. So these types of programs, there's many different types, but they work to identify the small groups of individuals within cities who are linked to the violence, and they provide them with supports to change their behavior and to de-escalate situations before they can escalate into violence. So I think both addressing Missouri's lax gun laws and really investing in community-based violence intervention that is highly focused on the few places and individuals who are at highest risk for violence those are both very promising. So I think that those, so I guess I'd say that. And then I guess I think that the other aspect is like rebuilding trust between and legitimacy between law enforcement and community. And that's going to take, a lot of repairing. But when you have clearance rates, that are well below 50% for shootings, that why would a community member want to trust in law enforcement when they see them over like someone said, over policing, but then under policing when it comes to the things that matter. So I think addressing that as well is super vital to addressing this really complex issue of gun violence.
Are there currently any policies in place at either the state level or in Missouri's towns and cities to address economic mobility issues? If not, please describe what policies you'd like to see implemented to address how income and gun violence connect. I'd love for everyone a chance to answer this, but Linnell, would you like to get us started?
Yes, per your earlier point about Missouri ranking very low in public health funding, I do want to quickly share some good news, which of all the tragic things that happened in this last year in terms of the COVID pandemic, one good thing is that our country is reinvesting in public health. So Missouri is anticipating getting a significant influx of funds to improve our public health infrastructure, and meetings have just started as to what to do with that. So I want everybody on the panel to know that and be able to weigh in on your very excellent ideas for improving public health in Missouri and what those funds can be used for, because wealth equals health. And so living in poverty does a number on your health, for your mental health, your physical health, and so forth. And we see that, especially Marcia acutely described some of the issues in Mississippi County. So county health departments, I think, are, very much keenly aware of the relationship between health and wealth and the need for public health to intervene. And so all of a sudden you're seeing health departments that, whereas we were focused on, mothers and babies and communicable diseases and sewage systems and so forth, now we're focused on low-income housing and whether it's available, and health and safety on our streets and what policies are in place to improve that, and working with our police departments, as Ari said, that, mending those relationships and gaining mutual understanding. So I think you'll see health departments across our state, especially if we can get some more funding and some more support from the state level, then we can implement these policies that improve health and then improve mental health, and definitely correlate with indicators such as reduced gun violence.
Great, thank you. Jessica, would you like to take this question? What policies, if there are any policies that exist, talk about them, or if not, what would you like to see either happening in your community or at the state level?
Absolutely. So I think one of the things that we've been trying to communicate to our members, and the Violence Prevention Commission has about 60 member agencies, more than twice that number in agencies that participate on a regular basis, that serve across St. Louis City and St. Louis County. And one of the things we've tried to communicate is that St. Louis is really on the precipice of a unique opportunity with the influx of more than $500 million in funds through the American Rescue Plan. And this is such a unique and once in a lifetime opportunity in response to the twin epidemics of COVID and gun violence in St. Louis to really make generational changes. And so some of the things that our new mayor, congratulations, Mayor Shara Jones, some of the things that our new mayor has been suggesting are universal basic income, which would guarantee a minimum floor of income for everyone in the city of St. Louis. We've also heard about reallocating resources from traditional public safety to other professions that can seek to help build that relationship. So victim services and social workers, and pairing social workers with police, and also a 911 call diversion. I think we've been very good at teaching folks to call 911 when they have an emergency. What we haven't been the best at is building out the back end services for people that don't need police, fire, and EMS. So we're supporting the city as they implement a 911 call diversion, where if someone calls 911 in the city of St. Louis, they'll now be able to access an unarmed clinician response instead of an armed police response. And we hope that will help to kind of build relationships and reduce the likelihood of police violence and negative encounters between police and community. We'd also really like to see dedication to implementing programs with wraparound services. So one of the programs that we have been looking at is out of Chicago, and it's called Ready Chicago. And it's an employment program that has subsidized employment, which obviously helps to overcome poverty. But in order to make lasting change, it also has wraparound services. So we know the reason that folks don't succeed in the employment sector is often not directly related to their performance. Especially in cases of generational poverty, a lot of the clients are one broken down car away from not being able to make it to their job. They're a loss of childcare away from not being able to make it to their job. We don't have equitable public transportation systems. We don't have equitable provision of childcare. And then Ready Chicago also brings in cognitive behavioral therapy to help folks deal with past trauma. We know from the DOJ diagnostic report that in the city of St. Louis, 70 to 80% of gun crimes happen in public spaces, which means they traumatize entire communities. And so we need to deal with the mental health toll that community violence is taking for people to be successful. And so we're hoping to see, and I think Mayor Jones has really put at the forefront, an investment in victims, an investment in mental health services, an investment in equitable provision of those services across the city of St. Louis. And so we hope that those will not only be borne out in the policies for the American Rescue Plan, but also going forward for both public safety and public health policies. It's vital that we address the income inequality, the racial inequality, and the unequal experiences of violence and trauma across St. Louis.
Thank you. I'm going to kick the same question over to you, Marcia. Policies that you would like to see again happening either locally for you or at the state level.
Well, I want to mirror a lot of what the presenters have just said. As Ari talked about, common sense gun law is one of the first things that needs to happen. Not only the concealed carry issue, but, Missouri does not have a state statute that mirrors the federal statute to allow for the removal of firearms in situations where a person's been convicted of domestic violence or has an active order of protection. I know that sometimes there's a reluctance in this state because everybody wants to talk about the Second Amendment. But after working in this field for 26 years, and now I'm on my third generation of families that I know and have worked with, I think that most of us, law enforcement individuals, whoever, if there was a moment in time that you knew you could remove a firearm from somebody's access and it would stop a homicide or a suicide, I think the majority of us would be willing to do that. So I think that we need to have some real serious talks and conversations and discussion and put politics aside and talk about saving human life. Almost everybody in Mississippi County, every family here and in the rural Boot Hill, Missouri, has access to firearms. I know of very specific situations where if that firearm just hadn't have been there at that time, people would be alive right now. And also to talk about wraparound services. That's definitely one of the things that we do here. There are not a lot of agencies providing services. So the agencies that are here very much have to provide wraparound services. So one of the things that we do is job training and internships and adult education. But when you provide that service, you also have to continue to work with that individual or that family to meet all of the other needs that were mentioned, like childcare. If childcare falls through, then what's that family going to do? If transportation falls through, then what's that family going to do? And in rural communities, there's not public transportation or a lot of other resources to follow on currently. So social service agencies like ours need to be funded and need to be able and willing to step up to the plate to meet that need, to literally provide transportation, to literally be able to provide childcare or clothes or whatever it may be that's going to prevent that person from being able to work and be self-sufficient. I also agree with one of the other panelists. We have to change the way we look at poverty and poor people. And we have to stop looking at it as being their fault. It's just like with us as a not-for-profit agency. I appreciate people donating us clothes or other things like that. That's great. But what we need is money and volunteer time to really be able to meet people where they are, assist them long term. There just really aren't a lot of short term fixes. And really, you have to be invested. It's easy for people to talk and say, oh, I want this to change, or I want that to change, or, for children that are in foster care, well, I would take that baby. But at the end of the day, people are not going to step up to the plate and do those things. So we as a society have to be more supportive and more understanding of each other. And then also we need definitely these safety net programs fully funded, and people need to listen to the individuals that are boots on the ground providing direct services to really, really listen to what those people are seeing and what they see the needs are, rather than just kind of doing pie in the sky policy without really talking to the people who are providing service and seeing what's happening.
Thank you. And I actually have a follow-up for you, Marcia, echoing something that you'd also mentioned earlier. A lot of what we're talking about here there's a generational component to it, and children growing up in families living in poverty are far more likely to experience poverty as adults than children who are raised in households that weren't in poverty. So, what can you describe what that looks like and what needs to be done within a public health framework to support people and prevent and try and put an end to the generational component to this issue? And Marcia, would you like to take it?
Sure. Like I said, I'm on about my third generation of families here, and I can tell you that literally with our domestic violence program, we're on our third generation sometimes of people who've lived here as children that are now coming into shelter with their children. The generational poverty, once again, until there's more opportunity for upward mobility, that's going to continue until there's more long-term wraparound safety net programs. That's going to continue. For the families that we really were able to get in and work with long-term, I have some people who still call me and talk to me that, I served 20 plus years ago. So until you can really get in there and build those relationships and find out what people need and listen to them and support them, empower them to do it. Not think that you have all the answers, or if they would just do what you want them to do, then everything would be fixed. We really need to listen to people get in there, be willing to stick for the long term, because when we're able to do that and really try to remove those barriers that keep people from being able to be successful and self-sufficient, that's the only way that people truly get out of generational poverty, other than just, the outliers that you have that just really beat all the odds.
Thank you. I'd also like to give Jessica a chance to answer this, specifically, especially as it relates to generational poverty in St. Louis.
Yeah, absolutely. I think one of the biggest factors that we need to consider is one of the ways that wealth is built across generations is home ownership. And with the history of redlining and with the history of neighborhoods, especially north of the Delmar Divide, being devalued, we see that many families, especially Black and Brown families in St. Louis, have greater issues trying to build wealth through that traditional method. And so addressing income is also needs to include addressing home ownership. And so we have an affordable housing trust fund in St. Louis that exists to help low-income families to buy homes, but it hasn't been fully funded. And so we need to fully fund the Affordable Housing Trust Fund in the city and create one in the county if we really want to develop home ownership to interrupt that generational cycle of poverty. And then really the generational cycle of violence. Prior to working at the Violence Prevention Commission, I worked for 14 years doing direct service with victims of violence. For about the last 10 years, I worked specifically with homicide victims and family and friends in St. Louis City and St. Louis County. And we saw the generational violence as an issue as well. We would have, I would work directly with mothers who lost a son to gun violence, and throughout the time working with them, they would also talk about how their son's father was either incarcerated due to their involvement in gun violence, or they were a previous victim of gun violence. And so until we interrupt both the generational poverty and the generational transmission of violence through these public health approaches, we won't see meaningful interruptions in this process. And that will require a lot of hard work. It will require policies. It will require programs. We really need to address the systemic racism and the lack of community involvement in defining what programs and policies will be put into place to interrupt the generational cycles of poverty and violence.
Thank you. So a lot of what we're talking about is long-term change that has to happen. And that's obviously crucial to move toward a solution and to preventing the gun violence. But what are immediate next steps that policymakers need to be taking to reduce violence starting today? Ari, would you like to take that one first?
Sure. Yeah. So I think we also have to think about how concentrated violence is also a driver of some of these inequities that we're talking about, right? So not only is racist housing policy and all these structural elements driving intergenerational poverty, but also, like Jessica said, the cycles of violence, those contribute to decreased housing values within cities. Those contribute to lack of opportunity and jobs within neighborhoods. So again, I think the immediate solutions for especially for community violence is really focusing, especially if we're going to be pragmatic and realize that, maybe potentially we can get funding for larger systemic change. But in the interim, we can invest in programs and work with the community to interrupt cycles of violence. So funding programs like Ready Chicago, like Jessica said, creating programs that use cognitive behavioral therapy to help folks de-escalate and rethink about how they use violence to resolve conflict. And so you've seen with a number of cities that have invested in it, whether it's Oakland or New York City, you've seen really large reductions in violence. And even in some certain neighborhoods in Chicago, you've seen that these programs, relatively small investments in these types of violence intervention programs can have really enormous reductions of 20 to 30% in violence. And I think that can also help alleviate some of those structural, larger issues that the cities and the state of Missouri are dealing with. So, I would say really investing in and working with the community to figure out what specific. There's a lot of different models that are used to interrupt cycles of violence, but working with the community and city stakeholders to determine kind of what model will work best, in the city, and really building that out and sustaining funding for that model over a sustained period of time. And I think you'll really see a strong reduction in violence in cities.
Linnell, would you like to answer that too? We've also had a question come in from the audience kind of in a similar vein, which is what can the average resident do to make change? But, with that in mind, if you'd like to answer to the policy maker or to the average resident, go for it.
Yes, I think I'd like to, Ari's the policy expert, but I'd like to focus on the childhood side of all of this and bring up the idea of adverse childhood experiences, which is in public health, we're really gaining an awareness of in terms of the importance of long-term health for individuals and communities. So what is that? That's children that have experienced adverse events as a child, and certainly witnessing gun violence would be very top of the list, or domestic violence or suicide, etc. And so recognizing early on that child has what we call a high ACE score, an average childhood event score, and treating that child early on through a referral process. So there are some school districts that have embraced this idea of assessing children for their ACEs and referring them for care. And I recall hearing in Ferguson the children that were immersed in all the events that happened there. Obviously all of a sudden they had high ACE scores, but what happened was they were being treated for attention deficit disorders and other symptoms, but not the root cause of why their behavior changed and what their stress level was. And once that was recognized, then, they didn't need all those meds. They needed care for the average childhood experiences that they've had. So investing in programs that help our next generation, I think, are a really good public health strategy. And in that vein, Missouri also, in terms of short-term policy changes, has really weak child access prevention laws in this state. And weaker than like Texas. So, if we were to approach a policy change, that might be a really good place to start, because everyone can agree that we want our children to be safe from guns, and also prevent teen suicides, which is on the rise, and childhood access prevention laws are shown to be effective in doing that. So the idea is that you have adequately stored your firearms in your home so that a child cannot easily access them, and very simple. So if you fail to do that, there would be repercussions. So that's what I've talked about in terms of childhood access prevention laws. And those are kind of my initial thoughts of some immediate changes that we can invest in our state.
Thank you. I got a question for Marcia. Everyone's mentioned this at one point or another today, but suicide kind of hides in the shadows of Missouri's gun deaths and in the nation's gun deaths. It makes up nearly 2/3 of gun deaths in this state. And while there are many complicated factors that can explain why a suicide would occur, a feeling of hopelessness and helplessness is a part of that. And I think everything we're talking about with related to income makes that true. So Marcia, can you talk about what that means, that suicide is this major part of the problem, and what it looks like in your community, and again how gun violence factors into this, because everyone knows it's the most lethal method for suicide. So can you speak to that?
Yes, unfortunately, I can speak to it from a personal level. My nephew Dylan completed suicide by a firearm in 2013. He had just had his 21st birthday. I don't know so much that it was an economic issue with him. Certainly, easy access to firearms didn't help. Dylan had moved, actually grown up around the St. Louis area, and then had moved here, back where our family's from. So it was quite a culture shock, I'm sure, and a big difference for him. So my family's learned a lot about suicide through Dylan's death. I can speak a lot to the domestic homicide suicide issue. The majority of suicides in our area or our county are related to relationship issues, relationships going south. Sometimes there's domestic violence. A lot of times there's domestic violence. Sometimes those are linked as well to a loss of a job or a huge change in the family circumstance, and just an overall, I believe, feeling of desperation and that there's no other alternative. There's no hope. There's no way to remedy the situation. There's no quick job to go out and get and fix. We've lost a lot of industry and really good paying jobs here in just the last few years as well. And all of those create additional stressors. But when I think about the suicides that I know of firsthand in our area, the majority of those have been men. There have been some women. The majority have been firearms. And the majority have been related, like I said, to either relationship issues or a loss of income, medical conditions that have made somebody not be able to work, and just a real sense of hopelessness is what I see here.
Thank you. I have a fact check real quick. So to provide some sources related to much of the discussion being centered on the role of income in poverty, we've got a little bit more context for that. According to U.S. News and World Report, Missouri ranked 33rd among U.S. states for economic opportunity. The median income is $30,899. 17% of people in Missouri living under the age of 18 living in poverty, that mirrors the national rate, according to the County Health Rankings report by the University of Wisconsin and the Robert J. Wood Foundation. And so as we move toward a close, we want to spend our last few minutes discussing the immediate steps that can be taken to address poverty by those watching. As is tradition with all of our American Public Square at Jewell programs, we want to give each of our panelists the opportunity to answer the questions, so what and now what. We'll just go through everyone, and if you can keep your answer really concise, as if you're writing a tweet or a couple sentences. So I'll send it to Jessica first.
I think one of the things to keep in mind is that we know the risk and protective factors for violence. Just like getting your COVID shot can prevent you from getting serious COVID, we know what makes you less likely to be a victim of violence. And we need to invest in evidence-based, community-informed, and trauma-informed violence prevention practices. These neighborhoods have strengths. Just because there's a neighborhood with concentrated poverty doesn't mean they don't have cultural institutions and important people and strengths. And so we need to take a strengths-based approach to these neighborhoods and allow them to define how they can build their capacity to leverage those strengths to reduce violence in their neighborhoods.
Thank you. Ari, would you like to go next?
So, firearms are kind of underlying all of this, right? Easy access to firearms is what leads to these high rates of gun violence. And it's not like this in any other developed nation in the world. So we know that we can reduce this if we take, a common sense gun measures and we push for them. I mean, I think just like we, took a public health approach to addressing traffic fatalities 50 years ago, and we reduced traffic fatalities per miles driven by 80%, we can do the same with gun violence prevention. And people can still have their guns, right? But for when we took an approach to auto safety, we made cars safer. We had airbags. We had a licensing system so that you couldn't just get on the road and drive a car. We enforced drunk driving laws. And so we can take all those same approaches to addressing gun violence prevention. And I think, if we start to think about it in that way, maybe we can move away from some of the political debating and just find some common ground and move this forward.
Thank you. Linnell? You're muted.
A part of this panel, and I'm very humbled by the other panelists, and they give me hope for the future, which I think is key message here is that maintaining and promoting a sense of hope. And I think these are hopeful times in terms of definitely with public health infrastructure. And so my message would be, if you have ideas for improving public health, which I think will naturally affect gun violence and reduce gun violence, then talk to your state legislator, because the funds are coming in and we're looking for ideas of how to spend them. And so I think a sea change is afoot, and we'll have much more emphasis on public health, which is definitely going to be important for Missouri moving forward to prevent gun violence.
And last but not least, Marcia, take it away.
Thank you so much for the opportunity to be here today and for being willing to tackle this difficult, multifaceted issue that affects so many of us. I agree with all the other panelists. Definitely we need to invest in communities and, as Jessica said, build upon the strengths that are in protective factors that are already in communities. Ari, your common sense gun law, I 110% agree with everything we talked about common sense gun law and legislation, and putting politics aside and putting people first. And that's exactly where I think we need to start.
We are nearly out of time, but this has been a lively and insightful discussion today. I'd like to thank each of our panelists so much for helping us to frame violence as a public health issue. I'd also like to thank American Public Square at Jewell and the Kansas City Star for facilitating this important discussion and allowing me to serve as today's moderator. Discussions like these help connect our reporting to the community. I would also like to thank Report for America and the Missouri Foundation for Health for supporting these important efforts. The Kansas City Star will continue to investigate the causes, consequences, and possible solutions to the gun violence problem in Missouri. If you want to support the Star's in-depth reporting and solutions-focused community engagement efforts, please visit kansascity.com/MissouriGuns. Finally, if you enjoyed this program and believe that conversations like this are important, please consider becoming a member of American Public Square. APS members help support programs and allow the organization to continue providing a space for civil, fact-based discussions. You can learn more about membership and its benefits by visiting AmericanPublicSquare.com or .org. Thank you to everyone who joined today's discussion or provided a question. This conversation will continue in the coming months, and we hope you'll learn from this conversation and feel more empowered to engage in your community as a result. Have a wonderful afternoon.